And check, see if we're live. And we are. What do you know? All right. Oh, hello. I would pretend like I haven't seen you already today, but the truth of the matter is you and I were on a conference call for 3 hours this morning for a project that we're working on. But for those people who are watching, I'm here with Alina Ebkarian. And how long have you been with us now, Alina?
I want to say about a year and 2 months. I think it was May when I first started because I was still taking 2 summer courses while working. So I want to say a year and 2 months. I don't remember the exact date. I have it on my phone, but a year and 2 months.
Yeah, it
Yeah.
actually seems like it's been longer. I mean, it seems like you've been part of the crew
Oh, yeah.
for a longer period of time. Speaking of finishing up a couple courses at the beginning time while you were working with us, give us a little bit of history for those people who don't know you. Give us a little bit of history on, what your background is, what your education is, what your specific interests are. Tell us about you and how fitness became a big part of your life.
So usually when I start talking about this, the first question that I usually get is, why the older population? Why? Why not athletes? Why not this population? And for me, I don't think there was a specific moment where I can refer back to and just be like, yep, that was the moment where I knew that the elderly population was my niche. I think it definitely started back in high school. I took a physiology course and fell in love, and I decided to continue to pursue kinesiology. That's how CSUN came in the picture, because ideally my goal had always been UCLA, but I was always undeclared. So when I took the physiology course, I was like, okay, kinesiology. And I looked at my options, and the only one that was available to me at the time was CSUN. So I was like, okay, perfect. And then in my first year, I joined a internship called Three Winds Fitness. So this was the pivotal point. It opened up so many doors for me. I was interning. So for those who don't know what Three Winds Fitness is it's a free exercise program that we hosted at a park for the locals. So I was stationed at Lanark Park, and I started off just interning wherever I can kind of fit myself. And then we opened up a Champions for Life. So our Champions for Life was our elderly population. So ideally 65 and above, or an individual who had some sort of limitation, functional impairment, or disability. So I went into that realm, and I was like, oh, this is it. I'm loving this. So from interning for the Champions for Life, the following year they made me program director. So I was like, okay, I started to create my own program. I started to embed balance training, mobility training, strength training, and just going based off the World Health Organization's recommendations, which I'll touch base on just a few minutes, into the program. And I love that. From there, I started working at independent living centers and hosting like Sunday group classes there for the locals. I did it at a couple different senior living centers, and I love that. I love working with that population. It definitely slows me down, and I move quick with a lot of things. So I feel like that's been my biggest takeaway. From there, I started working at the Brown Center. So the Brown Center is an adaptive therapy clinic that we have at CSUN. We have both a land and aquatic therapy. So I started with the land first because I wasn't really into aquatic as much. So with the land, what we focused on was overall rehabilitation. So again, this is for individuals who had some sort of limitation, functional impairment, and or a disability. And what I mean by that, or the individuals that categorized within that, primarily were Parkinson's patients, MS, stroke, PKNY, so many others. So I had experience working with stroke patients for about 3 years, Parkinson's for 2, MS, and a list of others. So that was again another point where I was like, I'm truly loving this. Besides the 3 Wins Fitness, this was definitely a secondary for me where I was like, I want to pursue this. I want to make a difference in those individuals' lives. I want to help them just gain their independence back. So with that, I started just climbing the ladder, talking to as many people as I could, asking honestly sometimes the stupidest questions and sometimes the most important questions, just because I'm very open and outgoing. So I was like, this is it, and I need to find a way up. I need to find a way in, and I need to find a way to make that difference. So I then took the aquatic training because I was like, I need to have the ability to do both on land and water training. So the water training was not my favorite. It, I don't know, not my favorite, but I definitely learned a lot. Required a lot more patience. But again, it was the same thing. Again, focusing on rehabilitating the full entire body. And what I loved about it the most is these are clients that you have for lifetime. It's not like physical therapy where you see the patient for 13 weeks, 15 weeks, whatever their insurance provides. This is an individual where you have for 3, 5, 7 years. And there's been specific clients that I've worked with for 3 to 4 years that I'm still currently in touch with. And I try to do the best that I can to help them out in any way. So I think for me, both the 3 Wins Fitness and the adaptive therapy clinic were my kind of eye-opening points. And then I was at Bon Bon and I saw Arena Fitness and I was like, oh, what is this? So I went in and I talked to Will and I applied and I was like, okay, let's see where this goes. I hadn't seen anything besides him in there, so I didn't really have a chance to see what you guys did, as in group training, personal training, and barbell training, and nutrition programs. All I saw was the equipment, and I was like, ooh, this looks cool. So I applied, and 3 interviews later, I got a call back, and I was like, oh, 3, not 1. So I think that was really cool, and I've loved it ever since. It's definitely been, I think I've learned the most in this year and 2 months than I have with any and everything else that I've done, just because of the clientele, the fact that I truly wanted to immerse myself in this and give it my all. Because when I go into something, I don't look at it as I'm going to be here for a year and then do something else. For me, it's if I'm going to commit, I'm going to give it my all and see and absorb as much as I can and then go from there. So this working here has taught me so much, and forever grateful for that. So yeah, that's my background.
Yeah, and that's awesome. And I'll tell you for the record, one of the things that I remember about you when you came in for your, I don't know if it was your first interview or whatever, but when we had the group interview, you were early, you were well dressed,
Mm-hmm.
and you asked a lot of questions. And that's one of the things that I've noticed about you is your curiosity and your inquisitiveness, and you're unafraid to ask questions, which I think is great because so many of us are concerned about looking bad. You know, we don't want to pretend we're more. And I have done this a million times. We are more concerned with not appearing to not know something. We're more
Oh yeah.
concerned with that than we are with actually learning something. And I think that's a huge impediment to growth. But you have always been very curious. And I think one of the things that we're missing in our culture nowadays is the concept of mentorship. And we just don't really have that. It used to really be a part of our culture that was very much just bred into the culture. You would try to become an apprentice to a blacksmith, you know, and you would basically sweep up the blacksmith shop for forever, and then maybe you would be made into a journeyman, and then at some point through the process of mentorship you would become a blacksmith yourself. We don't do that anymore. And I had the opportunity when I came into the fitness industry to work side by side with the owner of the company that I worked with, and it was a huge, it was one of the most beneficial and defining moments of my life, or periods of time in my life, having a mentor. And I soaked it in, and I was about your age at the time. I was about your age. And so it's refreshing for us to see the fact that you approach work with the same kind of ethic that we do. But here's a question for you. You are in your 20s. Do you have any difficulty working with people in the older population from a credibility perspective? Do you ever find that you have to demonstrate or prove your worthiness to people who are significantly older than you are?
That's a great question. And honestly, yes, I would definitely say more than I thought I would have to. With the internship, not so much. With the internship, not so much, only because of the fact that the individuals that were there had some sort of a limitation and impairment and or disability. So they felt that the attention that they were receiving was enough, just because these were individuals that were easily just kind of thrown into like home cares. So when they found a program that would accept them, no matter what level, what age, what condition, they were just ecstatic and on it. So for me, I feel like when I truly started to feel what you're talking about was when I started working at a facility, when I started working at a senior facility. And the reason for that is I'm young, and when people ask me my age, I have no problem telling them, yeah, I'm 23. And at the time, I think I was 22, 21. So people were like, we have a 21-year-old who's going to take us through a routine? Really? And I was like, yeah. So I love that initial reaction of you, but you're so young. Why this field? And that's when I start to crack open all my little shells and start talking about what it is that got me into the field that I'm in now. And I think once I start telling them more, showing them, once I start telling them about my background and showing them what I've learned over the 4 or 5 years that I've been doing this, that's when they're like, okay, you know your stuff and you're listening to what I'm saying. And I think that's the biggest thing is they see my age. It might be a physical thing, it might be a gender thing, or it might just be an age thing, and they see me and they automatically assume, what do you know about being old? What do you know
Yeah.
about the implications that come with, oh yeah, what do you know about the implications that come with being 50, being 60, being 70, so on and so forth? And to me, it's funny because I always, in my mind, I'm like, age is just a number. But I always just try to reassure them that no matter what it is, we're going to go through it together. Like, whatever the limitation is, as long as you're vocal, as long as you're willing to try whatever it is that we're going to find and prescribe, then we will get through this. So there are definitely a lot of loopholes that I kind of have to go through, where if I'm next to a man who's also a trainer, they will kind of listen to what the male is saying. But I'm at the point where I try not to let it bother me, because I'm like, at the end of the day, I know my stuff and I'm still learning. And I think that's the beauty of it all. I'm still learning from every single individual that I meet, every single individual that I train. So what were you
Yeah,
going to
so
say?
you may have to deal with gender bias as well as age bias,
Oh yeah.
but you seem to manage all of that pretty well. And it is unique that at your age you are as interested in the older population as you are typically, in my experience. Now I can't say that this is the case across the board, but just anecdotally from my experience, typically trainers that are in their 20s prefer to work with a younger audience, a younger population, and the athletic population, or people who are not just athletic but actually athletes, competitive athletes. So I think it's interesting and wonderful that you have a different area of interest. Now I'm going to put you on the spot a little bit. How would you define the older population?
So personally, I age does not really, I don't want to say matter, but is not the defining factor for me. So for me, it's not as simple, it's not as black and white as 65 and older. I don't see it that way. Personally, I see the older population, or the at least the individuals that I train, as an individual who has some sort of limitation, some sort of impairment, some sort of disability, some sort of, or is not currently active. So just because it's too hard to bundle someone of the age of 65 or all individuals 65 and up into a bundle, just because you have outliers like most of our clients who are 65. But listen, I would not train them. I would not put them through chair workouts. That would be too easy for them. So personally, again, it would be someone with a limitation, with a impairment or a disability, or is not currently active. So those are my four characteristics of the elder population.
Yeah, and I would actually go so far as to say that there's a difference between it. I'm not the one that has come up with this concept, but there is a difference between biological age and chronological age. So I'll tell you that
Definitely.
as a 50-year-old guy, um,
Mhm.
I have 50-year-old friends, a few, who are biologically probably 40 or 35 because they're so fit and so healthy. And I have 50-year-old friends who are 70, 75 biologically because they don't take very good care of their bodies, and so they have had an accelerated aging process. And those are the people that I worry about. And
Definitely.
so I can see how just going ahead and lumping the older population into a specific age bracket is risky, because you and I both know Bruce very well. He's
Yes,
65,
I would
and he's by no means biologically 65 years old. I aspire
definitely.
to be like him in
Me
15
too.
years because he is probably biologically my age. Um, I find it interesting to kind of see how we characterize the older population, because I think it's easy for people to get offended. Let me give you an example. My parents are in their mid to late 80s. My mom is 84 and my dad is 87. And if you uh, make any sort of suggestion that my mother has a lack of capability or functionality, or just overall physical ability because of her age, she does not like that, because she doesn't want to be limited by her age. And she
Definitely.
gets pissed
Definitely.
off at her doctors when the doctors
Mhm.
when she'll be asking about something that she's experiencing, and the doctor's
Mhm.
response, she changed general practitioners, because her general practitioner kept saying to her an answer to her questions, well, you're old, basically, is what he would tell her. And finally she's like, you know what,
Yeah.
that's an unacceptable answer, because she's kept herself in very good shape and so on and so
Definitely.
forth. So it is interesting to take a look. But um, the because I have parents that are in their mid to later 80s, the focus on fitness at any age is really personal to me, because they have always done a lot to manage their health and wellness. And as they get older, it's more and more important for them to do that. And there
Mhm.
are some pretty alarming statistics. So I wanted to see if I can't bring let me see, playing around with my screen here, and I made it expanded it, so now I can't minimize it. Anyway, there were some interesting studies that I was looking at that related to frailty, because
Mhm.
frailty is typically a condition that is most likely to occur later in life, unless there are chronic disease conditions that can contribute to frailty. But the reason that I'm bringing up frailty is that it is a very significant and serious concern for the older population. And it's a
Definitely.
serious concern because frailty has been associated with a reduced quality of life, It has been associated with increased mortality. And so frailty can actually kill you, essentially. And some of the factors that define frailty, there were 4 or 5 characteristics specifically, and I can't bring the article up right now, so I don't remember all of them. Do you have them? Okay, so I know it's like grip strength, it's unintentional weight.
Yes. Impaired strength,
Okay.
loss of gait and balance, increase in body composition, fatigue, as well as an increase in hospitalizations. At least the study that I was looking into. But I think the one that stood out to me the most, which I know that you had mentioned, was activities of daily living. What happens with individuals who experience frailty is they have to become dependent when conducting activities of daily living. So,
interesting, and I don't know that this is
one.
true because I didn't vet this, but there was a really good video that came out a couple of years ago by a guy named Mike Vacanti, who is a well-known kind of celebrity trainer in New York City. Intelligent guy, young, he's in his late 20s, early 30s. But he did this really, really great video about why exercise matters. And at the beginning of the video, and I haven't vetted this to determine whether it's accurate or not, but he said, the number one reason why people in the older population have to transition to assisted living is because they lack the ability to get up and down from the toilet. And so his point was, we're talking about a very simple, primal movement. Somebody is incapable of doing a half rep.
Yeah.
And because it has such a significant impact on their ability to live alone, they have to commit themselves to assisted living, which I think is, I don't know if that's true, but that's pretty shocking if it does. And so, and we talked about, you said you have some pretty interesting statistics about sarcopenia too, which is muscle loss.
Quickly going back to what you had said, it's funny that you mentioned that because I've actually worked with a client who at 3 Months Fitness, whose goal was to be able to get off and on the toilet.
Yeah.
And that was his goal coming in. And it's funny that you mentioned that because I've actually had a client who's told me that. So long story short, just want to touch base briefly on him. He got diagnosed with GBS. I don't know the logistics of that, so I don't want to quote something and then be completely off. But long story short, he experienced low body paralysis. So when I met him, this was when I became program director. And I took him into the program, but I want to say hesitant. I was definitely very nervous because he had no movement in the hands and no movement in the lower body. So over a course of a year to year and a half, I want to say, we were at the point where we were on and off the chair, completing 10 full squats on a chair and doing 1 lap around the whole park, which is about quarter mile. So I really wanted to touch base on that just because that goal was such a specific goal, and I've never heard of a goal that specific. I know when we're talking about goals, specificity is one of the most important things, but I've never heard a goal that specific. So I think it was beautiful for him to kind of pull me aside and just tell him, have him tell me his goal and be able to complete it in a year time frame. And it took a while. It's because I saw him twice a week, but we did everything that we could and completed that goal. So going back to sarcopenia, were you going to say something?
Yeah, I was just going to say, I mean, for you and for me, the simple act of getting up and down off the toilet seems like something that would be easily taken for granted. But when you think about it, what a loss of independence that is. What a loss of personal privacy it is to have to be assisted. That's a private moment. Nobody wants to be sharing the bathroom with anybody else. And it really is a loss of independence to have to rely on somebody to help you do something that you're going to have to do multiple times throughout the course of the day. So
Exactly.
That's the stuff that matters. That's the stuff that matters.
Exactly.
And in that video, Mike Vacanti says this. He says, you know, getting abs so that you can post selfies on Instagram, that kind of stuff doesn't matter. Being able to do 100 burpees is impressive, but that's not the stuff that matters. Being able to get up and down off the toilet, being able to play with your kids or your grandkids, being able to carry some groceries in and out of the house, being able to go up a flight of stairs without assistance. Those are the things that matter, and that's why fitness is so important. It's not about how you look or posting pictures on Instagram. It's about preserving the quality and the functionality of your life so that you are never forced to watch from the sidelines.
Exactly. And honestly, that's beautifully said. That can be a discussion in and of itself, but I think you definitely nailed it. And I know you just briefly mentioned sarcopenia, so I just
Yep.
wanted to touch base on that. So sarcopenia, the way at least I've seen it defined, is a loss of muscle mass. So to be more specific, we see about a 12 to 15% loss of muscle mass per decade over the age of 50 for individuals over the age of 50, both male and female, which is big. This is a contributing factor to a loss of bone density, which we see are osteoporosis, osteopenia, and loss of muscle fibers. So
loss
again,
of strength, loss
exactly.
of balance, loss of joint stability, and all of that stuff.
Yes. To tie into that, in that same study, they had about, I want to say, 500 some individuals perform resistance training for 4 months, and they saw about a 16 to 23% increase in muscle mass. So from the 12 to 15 that they had lost, they saw a 16 to 23% increase in muscle mass in just 4 months with resistance
Amazing.
training. It didn't go specific into what kind. It didn't go into the specifics of the kind of resistance training. But when you refer back to the World Health Organization, they recommend 2 to 3 sessions a week of strength training, and that could vary between 20-30 minutes. So I'm going to assume that it was part of those guidelines, but it's great to know that you can come back from sarcopenia, you can come back from osteopenia, you can come back from strength losses.
And at any age, too. I don't know if it stipulated what the age of the participants in that study was, but I've seen many studies with people in their 70s, even into their 80s, that have demonstrated the ability to regain lost muscle tissue, strength, balance, mobility, quality of life with strength training a couple times a week. And that's why it is so critically important. It's the fountain of youth. And it is, I consider strength training and exercise to be like a full body vitamin. But now, since you're on that subject and you were talking about kind of like the World Health Organization guidelines, walk us through that. What are just kind of like the general physical activity recommendations set forth by the WHO?
So the World Health Organization recommends about 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous exercise. So I want to kind of just touch base on the word moderate and vigorous. So your moderate can be anywhere from a walk, a bike ride, a swim, dancing, yoga, whatever the case may be. Whereas your vigorous intensity is more of your jog, your jog, your runs, your sprints on bikes, your sprints in the water. So it's basically taking it up a notch in terms of heart rates. So that's their aerobic recommendation. Their strength training recommendation is 2 to 3 strength training sessions per week. Their third recommendation.
Before you move on, can you and I talk just for maybe 30 to 60 seconds on what do you consider strength training? Because I think there's a lot of confusion about this. People go into, an interval training class that is primarily cardio or conditioning or endurance based, but because there's a dumbbell there, they think of it as strength training. How would you characterize strength training?
So I would categorize strength training as some sort of external load being placed upon your joints, upon your muscles, upon the tendons. That can be taken in a form of your own body weight, in the form of a dumbbell, or in the form of a band. So I don't know specifically in terms of heart rate zones where you should be with a strength training program, because there have been times where I've lifted and my heart rate has gone up to a level of one where I'd be running. So I don't know the specifics of a heart rate zone, but the generic idea behind strength training is placing external load upon your joints and upon your muscles to have them adapt and grow to that stress. So I would categorize it as that.
And that's an important
different way of categorizing it.
Well, I mean, listen, what's funny is as long as we've been in this business, I've never looked to find out if there is a consensus around what strength training is considered, but you nailed it, which is a load that places the necessary stress on the skeletal and muscular system such that it has to adapt, right? So you've got to be forcing progressive overload. So you have to force adaptation. So it's got to be enough weight that it is placing a stress on your body, but there's good stress and there's bad stress. So that would be a form of good stress. It has to be placing enough stress on your body that your body is adapting to be able to manage the stress. Now, there are studies that show that you can gain lean muscle tissue lifting moderate amounts of weight. It doesn't always have to be, super heavy. So that's one myth that I think it can be intimidating for people, is thinking, well, now I've got to go and I've got to clean 400 pounds. I've got to bench press 300 pounds. That's not accurate. You can gain lean muscle tissue through lifting moderate amounts of weight. You just need to lift higher reps so that time under tension is longer, and then you fatigue the system, all of that, and you create stress and it adapts. So anyway, so we agree that it has to place enough stress on the musculoskeletal system to force adaptation. Okay. All right. Go on. That's a mouthful, by the way. Musculoskeletal. That's my Achilles heel right there, man. I got a hard time with that word.
Mine is compartmentalize. I have to look somewhere and think about the word to say it properly.
Right.
Compartmentalize. Got it. And the third recommendation is flexibility training, or mobility training at least 3 times a week. So I would personally say that is your step 1. So if I were to put it in a little tier, that would be the first one. Just because you got to have healthy joint range. You got to be able to take the joint through a full range of motion before you load it. So flexibility training should come before your strength training. And then your aerobic can be done in between, before, after, so on and so forth. So I know that 150 minutes seems like a lot. So when talking about the older population, the mentality that we have on this is some exercise is better than no exercise. Yeah. So what I mean by that is individuals in the older population should be as active as they can. And some easy ways that implementing this into your day-to-day can be taking the stairs instead of the elevator, parking your car further away from your destination, taking your dog out for a walk, walking or biking to your destination instead of driving there, doing some light strength training or light exercises while watching the TV. So these are ways where you can allow yourself to dissociate from the fact that you're doing a movement and still gain the benefits of the exercise. So those are the World Health Organization.
I think you make a really good point, because exercise really is dose dependent, right? And a lot of the time, I think that we discount 5 minutes of exercise, 10 minutes of exercise, because we've gotten programmed into this idea of doing 30-minute, 45-minute, 60-minute classes and so on and so forth. But the reality is it's dose dependent. So the more of it is always better up until the point where you're placing an unreasonable amount of stress on your body, which you and I are not going to do. You know, most people don't run the risk of that. So it's dose dependent. So every bit helps. And I tell people, if you're just getting started with an exercise program, 5 minutes matters. You know, if you're starting with nothing, 5 minutes matters. But the whole point of what you're saying is that in order to get 75 minutes of vigorous exercise or 150 minutes of moderate intensity exercise, you can do it in a variety of different ways, by walking farther to your car, just everyday activity, because we do become sedentary, more and more sedentary as we get older. So what are some of the reasons? Why is it that we stop moving?
So there's a couple, and I want to start with the one that you mentioned. So frailty, that one is the number one. I know we touched base on that, so I'll go ahead and continue from there. So frailty being number one. Another one is our pre-existing health problems that can range from diabetes to whatever else, weight gain, pain, fear of falling, and the fact that exercise isn't for you. So those are the main ones that we see in terms of why we become more inactive as we age. But the causes of inactivity are the one that we already mentioned. So sarcopenia being the fact that we do see a decrease by about 12 to 15% of our muscle after the age of 50. Another one can be increase in body fat percentage because of the fact that we're sedentary. Again, the two biggest ones are going to be loss of independence. So your quality of life just plummets.
Yeah, absolutely. So
I would end off, that.
Yeah, so let's talk about some of the physical benefits. You and I kind of talked about some of the studies. Let's talk about longevity studies. You cited a couple of longevity studies, and I think that's important because we're talking about the older population. So if we're talking about the older population, let's talk about the extent to which exercise can contribute to a long and healthy and fruitful life.
Yeah, definitely. So longevity being one of the biggest changes that we see. So a Swedish study found that with an increase in physical activity, we see an increase in longevity. So physical activity was the number one contributor of longevity. Harvard School of Medicine went ahead and took that study and went a little more in depth and looked at heart rates. So when you become more physically active, what you do is you decrease your heart rate. By decreasing your heart rate, you can add to your longevity.
Right.
Your heart doesn't have to beat as much to send blood to the whole body. Right. So I thought those two were interesting. Another one is, did you want to touch base on longevity on your end, what you got?
Just that as a general principle, many times when I'm in the course of studying all the things that I study and research, because that's what I like to do, exercise is most commonly cited as the number one factor in longevity. Is you're going to pick up one good habit and you've got to choose, for some reason, choose exercise, because that is the number one thing that will contribute to longevity. So I think it's important for people to understand that. And if you are an older person, or if you have a mom or a dad or a grandparent or a neighbor who's an older person, and they kind of come from that mindset of, I was never an athlete, I never worked out, it's not for me. I think we need to shift away from that mentality to, look, you don't have to be a gym rat. You know, you don't need to be spending 6 days a week in the gym doing CrossFit. This is about taking walks. This is about practicing some fundamental, simple movements like sitting down and standing up, like lifting objects over your head, doing the things that would translate to everyday movement. So for somebody who's an older person who may not have grown up inside of a culture of exercise, I think it's important to maybe deconstruct it a little bit and say, look, forget everything that you think you know about exercise. We're just talking about moving. Move your body. I don't even know if I like the term exercise. I like the term movement. Move your
Mm.
body. But that's the one thing that I would emphasize, is that exercise is very commonly cited as the number one factor when it comes to longevity. What are some of the other benefits of exercise?
So I want to start with the physical benefits, just because we also see mental benefits. So with the physical one, we already touched base on longevity. Another one is maintenance or loss of weight. So the reason for that is when we become less active, so leaning towards sedentary, we have a decrease in our metabolism, which can be a contributing factor to weight gain. By becoming more active, what we see is with an increase in activity, we see an increase in our metabolism. With an increase in metabolism, we're able to digest and burn those calories to to decrease our body composition. So the second one is maintaining or losing weight. The third one is
Yeah, and on
reducing the
that point,
impact
I
of
just wanted
chronic
to I
illness.
just I just wanted to jump in and add to that exercise has been shown to burn visceral fat, abdominal fat,
Yes,
which is the
yes.
dangerous kind of inflammatory fat. And it also, exercise makes your muscle cells more receptive to blood sugar. So it offsets insulin resistance, which is
Mhm.
a good thing to avoid type 2 diabetes as well as weight gain.
Definitely, and just tying into that, chronic illness,
Yeah,
just the way you exactly said it, it can definitely combat that. What it exactly does is it improves your immune system and your digestive system, which are just the two most important systems in the body.
yeah.
So,
And much of your immune
and the
system
last
is in your digestive system. So those go hand in hand. That's so important.
and the last one is an increase in mobility, flexibility, and balance. I wanted to quickly touch on balance, just because that is one of the areas that I deal with in terms of fitness training, elderly fitness training. The biggest thing that I focus on is balance, just because that is where most of the by increasing balance, we see an increase in quality of life. By increasing balance, we see independence. So I feel that with an increase in physical activity, and I want to use physical activity instead of the word exercise, because it can mean anything to it's individualized. It can be dancing, it can be walking, it can be swimming, it can be whatever it is that that person enjoys. It doesn't have to be your typical lifting if it isn't for you. So with an increase in exercise, we see an increase in balance. With an increase in balance work, we see an increase in the overall quality of life of that individual. And I think that's beautiful. The fact that by practicing balance, an individual can gain their independence back and not have to rely on someone else to assist them sitting and getting off of the toilet, like we had just mentioned.
Absolutely,
Um,
absolutely, and and increased confidence. Because people are afraid. Sometimes some of the parents, grandparents, parents-in-law in my life, I will see them wanting to do something, but having a lot of trepidation and fear because they can see that the ground is uneven or
yes.
unstable, and they're thinking, I can't even go over there to see the beautiful view because I'm afraid that the uneven terrain could cause me to
Mhm.
fall. And so addressing balance and mobility, it just increases confidence, and it increases your ability to do the things that you want to do in your life. And then that also kind of ties into the cognitive benefits, the mental benefits as well.
Exactly. So with the cognitive benefits, we see improved sleep, and I know you've had a separate discussion about sleep, so that is something that we don't really need to touch base on in depthly. But we do see improved sleep. We also see improve and a boost in mood, just because when you exercise, you release endorphins, and endorphins are known to fight against stress, depression, and anxiety.
Yeah.
So that is a very big takeaway with becoming more physically active. And we also see a decrease in Alzheimer's and dementia. So that one isn't an exact correlation, but there have been studies that have been coming out just kind of pointing at the fact that with more exercise, especially cognitive exercises, when I do my when I do my senior fitness, I like to go with some mental games as well, where it's like you associate a movement with a specific color, you associate a movement with a specific shape. So you're working their brain as well as their body. So by doing mental exercises, you can fight against Alzheimer's and dementia.
Yeah, so the benefits to exercise, I mean, it's amazing that at this point in the game, we still have to be talking so much about the benefits of exercise, because there's just no literature out there that shows that a lack of benefit, you know, or that shows that there would be some sort of deleterious effect from exercise. It's all good. Like talk about an activity that about which there's no controversy. There's no controversy about this. Exercise is not only good for you, but it promotes longevity. It promotes greater quality of life. It promotes cognitive improvement. It offsets and can help you avoid chronic illness and all of that stuff. So it is really the fountain of youth, or the full body vitamin, as I like to call it. But let's talk about what inactivity does. The process of inactivity. When you're sedentary, your bodies are really not meant to be inactive, and so really being in a condition of prolonged sedentism is really a state of decay. You know, your body's deteriorating.
Yes.
Some of the side effects of that.
Mm-hmm. So again, just want to reiterate, the biggest one is going to be sarcopenia, which is the loss of muscle mass. Another one that we tend to see is osteopenia and osteoporosis, which are your decrease in bone density. The difference between them is osteopenia, you can still come back from. So osteopenia isn't as severe as osteoporosis. In osteoporosis, the bones are extremely frail. Jesus, yeah. Extremely frail. So with an individual with osteopenia, they can still become physically active and they can still reverse that. And we've had clients in the past who have come to us with osteopenia and have been able to reverse that completely. And the third biggest one is going to be the loss of independence, which I think is it just trumps everything. I think that is the reason why I got into what I'm doing now. That's the reason why I'm as physically active as I can be, as mindful as I can be, just because I want to be in my 60s, 70s, 80s, playing with the grandchildren on the floor, not needing that assistance.
Absolutely. And so we kind of touched on this a little bit before, but what are some of I mean, really it's just about moving your body, right? So what are some of the types of exercise or physical activity or movement that you would recommend?
So I would go with, I want to say 4 types. So one is your aerobic. Aerobic is an intensity that you can just maintain for a certain period of time. So that can be walking, that can be swimming, that can be dancing, that can be anything that you want it to be. That's going to definitely challenge you just a little bit, but just gets your body moving. So aerobic being one. The second one being strength training, which we kind of already discussed the parameters, which can be done in a form of using dumbbells, using your own body weight, and even using bands. The third one is flexibility training. And these are in no specific order. It's just whatever order that's been coming to mind. So your flexibility training, which again, just promotes healthy joints, healthy movement, especially within the whole range. And the fourth one being balance. So this is the one that the World Health Organization doesn't go in depth with. So with your aerobic, you have a set number, 150 minutes of moderate, 75 minutes of vigorous. With your strength training, you have a set number, 2 to 3 2 to 3 times a week. With flexibility, again, you have a set number. With balance training, there isn't a set number. And that can be tricky when it comes to prescribing balance, because how much is too much, how much is too little. So I always kind of end up thinking about that. And honestly, at the end of the day, I think there is no too much with that. I think implementing balance into your everyday life can definitely be beneficial. That can come in a form of Tai Chi, in the form of heel to toe walking, in the form of balancing on your leg like you posted. Maybe not with your eyes closed unless you want to challenge yourself. And basic chair balance exercises for those who are not comfortable leaving their chair. You are able to do balance exercises within your chair and still challenge your 3 balance systems to improve them.
Perfect. So, so let's kind of wrap up on the concept of any final thoughts with regards to fitness at any age and making sure that we're continuing to exercise forever. And also, in particular, if you've never exercised, it's okay to start at 60, 70, 80 years old. That's perfectly okay. So any final thoughts on exercise for longevity, exercise for promoting your well-being for a lifetime, or starting at an older age?
And I'm going to tie it back to what you've mentioned, that for those who are currently sedentary and have some sort of itch to kind of start exercising, it's about the small steps. It's not about going to a 45-minute HIIT class, a 60-minute strength training class. It's about what works for you, and that it's individualized. It can be in the form of walking, in the form of doing some light exercises while watching the TV. It's just about finding something that makes you feel comfortable, because one sort of exercise isn't the end all be all of exercise. There are so many different forms out there, and it's just about taking the time to finding what works for you and what you like. So, and that would be my ending message, that you're never too old to start. I don't like the word old, but you are never too old to start. It is never too late. And it's about doing the simple things. It's not about hopping into a class. It's not about forcing yourself to do something you don't want. It's about taking care of yourself and taking that initiative to make a 5-minute change in your day-to-day life.
Totally agree. I think that, it's the biggest show of self-respect that we can have, is really making sure that we take care of ourselves. Life is challenging enough, and it would just be a real shame if our bodies gave out on us before our spirits did, and only because of a lack of maintenance and a lack of attention, and out of just negligence. And so every bit of exercise counts. And the people who are in their 60s, 70s, and 80s, we need you. We need those people. Those people are they are libraries of information for those of us who are a little younger, and then those of us who are quite a bit younger. And there are some, I'm gonna destroy this, but there was some quote that I read that said, every time an elder dies, a library is burned to the ground. And I think that's really an amazing, I may have butchered that, but it's something to the effect of, every time somebody who has been around for a significant amount of time passes away, there's just so much wisdom and knowledge, and that is lost with them. And so we'd like to see, we need some of that these days. We need as much of that as we can get, because it's a crazy, crazy time. So thank you very much for all of that information. I just want to pivot a little bit at the very end and talk about the fact that everything's beginning to open up. Gyms are opening up, hair salons are opening up, so on and so forth. And people have been and are very, very eager to begin to resume their normal exercise routine, because I think you and I can both agree, and we've talked about this, none of us are performing optimally right now. Under quarantine conditions, very, very few people are able to maintain the same level of rigor and commitment to their exercise that they did prior to the stay-at-home orders. I stay fit, but I haven't been quite as diligent as I was prior to the stay-at-home orders. So a lot of people are really eager to get back at it, get back into the gym. What do we need to watch out for? What do people need to pay attention to? What are some steps that people need to take as they're preparing to re-enter the training environment?
Definitely. I think the biggest one that we just got to be mindful about is the fact that, like you said, we've been in quarantine for about 2 months, maybe 2+ months at this point. 3 months at this point. We have all lost some sort of our abilities. And I don't mean to say that in a negative way. I have no ill intention with that. I just mean that it is natural to have lost some of our abilities, but it doesn't mean to say that we will never gain them back or even surpass them. So when coming into the facility, it's going to be very important to keep that in mind. It's going to be very important to just be easy on yourself. Go light. Tone it down just a little bit, just until your body gets accustomed to what we're doing. And I think another thing to focus on is the mobility. I think the mobility should be the priority in coming back, just because we need to have healthy joints and full range of motion before we load up that body, before we load up our joints and our muscles. What about you?
Yeah, I agree with all of that. I think that mobility is really important because most people, myself included, even though I stay very active and I do mobility exercise pretty much every day, most of us have been either less active or just in a completely different setting. And that's probably having an impact on our mobility, our ability to move dynamically. And so I think we need to really make sure that we're paying attention to mobility. I think people need to expect to dial it back and go at 50% for a while. Allow your body to adjust and adapt, because it is going to be a change for people as far as the training intensity, the training environment, the training demands, the bodily demands. We need to pay attention to heart rate, which is one of the reasons why we're requiring everybody who comes back to wear a MyZone belt, because that's going to be one of the only ways that we as coaches can keep people safe. One of the things that you and I talked about is the fact that we are going to be requiring masks for everybody who trains or coaches inside of Arena Fitness. Everybody's going to be wearing a mask. I have engaged in many, many debates about the mask issue, and I get it. I get people's reluctance to wear a mask, especially when exercising. It's not ideal. But at this point, the weight of research is pretty soundly on the side of suggesting that everybody wearing masks is important for suppressing the transmission of disease. And if we're all in a confined space, we're going to be providing quite a bit of distancing for people, but we're still going to be indoors in a confined space. Everybody needs to be wearing a mask in order to tamp down on the exhalation of particulates into a shared space. And wearing a mask presents different challenges for people. I know that when I wear a mask, my heart rate zone is usually knocked up a notch. I'm usually 10 to 15% higher when I wear a mask and I go running and I work out in a mask, which I do, than when I don't wear a mask. And so people are going to need to get accustomed to that. And that's why we need people to wear the MyZone belts, so that we have clear data on how they're doing when they're working out as far as their heart rate zone. Because if you're wearing a mask, we're not going to be able to see facial cues that indicate a level of discomfort that we would normally see. If I'm training like this, you can't see my face. So the only data that we can rely on is what we're going to get from the MyZone belt. So I think people need to really pay attention to heart rate, they need to lower their exertion, and they need to begin to get comfortable or familiar with, anyway, exercising with a mask on. So they should start doing that at home.
Yeah.
So I think
you
that's
and I have noted it's very different to wear a mask and do exercises. Like you said, a level, you're up by a whole block. I'm up by a whole block. On exercises that I'm typically in, blue have got me up to 75, 80%.
yeah.
And it's fun to practice with it.
For sure. So it's not about MEPS. It's not about counting calories. It's about our ability as coaches to make sure that we are keeping our members safe while they're exercising under these conditions. So that's pretty much it from my perspective. Do you have anything else? Any final words?
No, what was it?
No. And what's cool about this is this was really just a broadcast example of the many conversations that you and I have had behind the scenes, you know, and all these times when we do these discussions on Facebook, this is really just a peek behind the curtain to see what do we do on our off time. We have these kinds of conversations, and it's fun to kind of turn the camera on and let people inside of the conversations that we're having anyway. I enjoy it, and I hope people find benefit from it. And so this was great. I appreciate you spending time with me today.
Thank you.
All right. So I will talk with you soon. Have a great day. And that's it. I'll talk to you soon.
Enjoy the rest of your day.
You too. See ya.